Hello, David Foster here, not at the round table, but virtually there, as you can see, behind it, some distance from our usual home thanks to coronavirus. Now, we are constantly being told that with this disease we're in it together, but while it is a global pandemic, a coordinated global response just isn't happening. Is it at all possible? Well, the World Health Organization, according to Donald Trump, blew it. Others have said it's being soft on China, not acting as it should when the words world and health are in its title.
It is being called a war against an invisible enemy and is now being fought on a global scale. The world is in a race to stem the increasing number of coronavirus cases. Confirmed infections worldwide have passed the 2 million mark, and governments and healthcare systems are struggling to keep up. Even among the richest nations, the spread has been rapid. Restrictions on people's movement and mandatory quarantines are in place in many countries. But experts say COVID-19 is a global problem that needs a coordinated response. And the World Health Organization has faced criticism for its handling of the outbreak. The UN Secretary General Antonio Guterres has called the pandemic the fight of a generation and a threat to world peace and security. So can nation states put their politics aside and come together to fight a common enemy?
Well, in a short while, we'll be talking to the political analyst Anthony Dworkin, who says one problem is a leadership vacuum. Also, Bay Nishi, who runs a global health coalition pushing for new technologies to save lives. Right now, let's introduce Rifat Atun, professor of global healthcare systems, Harvard University. And Rifat, you've worked around the world. I say Harvard, you're actually in London now because you can't actually get out. You've been advising the G20, the group of 20 biggest countries in the world about this. Are they petrified about what might happen, or do they have an idea what they're going to do?
Yes, G20 has a very important role to play in this pandemic, not least because this is a major health issue for G20 and the world in general, but also G20 have mandates in relation to economy, finance, all the other streams beyond health. And what we're seeing in relation to the pandemic is that beyond the health consequences, there are huge economic and social consequences that will come, and the countries will need to respond to that. So I think this presents a remarkable opportunity for G20 to develop a comprehensive and integrated response. As the saying goes, never let a crisis go to waste. So this is a great opportunity to grab the
But
bull by the
generally, do
horn.
you think they have been a bit slow on this, waiting to see what happens next rather than having a plan of action at the very beginning?
Well, I think as you commented earlier, there's an important question. Who is leading? No institution in the world has the mandate to lead. Although the World Health Organization's the United Nations agency with the mandate for health, they do not actually have authority over countries. So countries are very much at liberty to do what they wish, taking into account their capabilities, but also the effect of the pandemic on health, economic, and social areas. So if there is a vacuum, then G20 could actually help fill that vacuum, and working very closely with the World Health Organization and other agencies such as
But sorry,
IMF
some
and
of this
World
may be
Bank.
confidential, but can I ask you what the one biggest piece of advice that you would give to them would be at this juncture?
I think G20 has an opportunity to come up with a series of actions to improve coordination, coordinated action in relation to not just the response now, but also in lifting the restrictions, and also coordinating the financial support and the economic support that countries need, not just for G20, but very importantly for low income countries that are going to really bear the brunt of this pandemic. So I think there's an opportunity to come up with something that is not a statement, but actually series of implementable actions.
Okay, so Rifat, you mentioned low-income countries there. Let me just quote Bill Gates, who says COVID-19 hasn't yet hit many low and middle-income countries hard. We're not exactly sure why, but what we do know is that the disease will eventually spread widely in these nations, and without more help, the caseloads and death tolls would likely be worse than anything that we have seen so far. They just aren't equipped to cope, are they?
Absolutely, they're not. I had the privilege of working at the Global Fund as a member of the executive management team from 2008 to 2012, while we were trying to develop a comprehensive response to addressing HIV, tuberculosis, and malaria. And one of the big challenges we faced was that even when the money was available, health systems were extremely weak. There was no capacity to utilize the funds to scale up the interventions. And many systems in this country are still very weak, as we have seen with other problems that countries have faced. So when SARS coronavirus 2 increases in number in these countries, I'm afraid the risk of catastrophe is very, very high indeed.
And of course, one of the saddest things about this stuff about we're all in this together, that rich countries, poor countries aren't in this together, because when it hits the poorest countries hardest, they may well be forgotten. How do you stop that from happening?
Yes, although we say we're in this together, the response has been anything but that. I mean, they say that pandemics are the great equalizers, but actually in this case, what we're seeing is widening of inequalities, both among countries, but also within countries, with the most vulnerable countries and individuals affected. And even within the European Union, in the early responses, we've seen countries closing their borders, restricting exports. So there has not been a coordinated response. And this is really not acceptable. So in relation to low-income countries, I think along with WHO, G20 could play a very important role.
Is that lack of a coordinated response something that was inevitable, or is it something that the world community as such should be ashamed of?
It is inevitable in the sense that there is not a single body that has the legal mandate to do this. So WHO is not like the Security Council. There's only one treaty related to health that is legally binding. That's the Framework Convention for Tobacco Control. And even then, the countries need to approve this in their parliaments for their implementation. The rest is actually guidance by WHO, which member states should adhere to, but do not have to adhere to.
Well, listen, we say thank you very much indeed. Appreciate you coming on, Rifat Atun, who's Professor of Global Healthcare at Harvard University. When and if you get the opportunity to return to the United States, we wish you all the very best. Thank you.
Thank you.
Okay, right now on Roundtable, let's introduce Anthony Dworkin, Senior Policy Fellow at the European Council on Foreign Relations, and Jamie Bay Nishi, Director of Global Health Technologies, an advocacy group pushing for new ideas to improve health worldwide. Jamie, with you in a moment, but Anthony, first of all, our last guest, a professor of healthcare at Harvard University advising the G20, talked about challenges, talked about opportunities, but there was no mention of leadership. Is that missing?
Yes, leadership has been missing. And, you know, they say that a crisis kind of amplifies the problems that are already there, or it finds the weak spots. And this crisis, terrible as it is coming at a time when there is a real absence of global leadership. You know, in previous health crises like this, many countries around the world would look, first of all, to the United States to lead on a global response. But that really hasn't been the way that the United States under President Trump has reacted. It's been, as we know, President Trump distrusts global institutions, and he governs explicitly on a policy of America first. And so his response has been very much geared to his domestic audience and to trying to ensure to do what he can to build up his domestic popularity and ensure supplies for the United States.
Yeah, we know that the World Health Organization doesn't have an awful lot of power. It's an advisory group. Governments can take its advice or ignore it. Is it being pilloried unfairly?
Well, I think it is pretty clear that the World Health Organization was slow off the mark in this crisis. They underplayed the significance of the disease at the beginning. I think they were reluctant to challenge the narrative that the Chinese government was coming up with. And there's been a lot of comment about the influence that China has over the WHO and over the current leadership, which was put in place with Chinese support. Since then, I think the WHO has done better, but they still are fairly short of resources and are kind of struggling to make up ground, I think, and struggling to coordinate a global response at a time when many countries are inwardly focused.
So let's throw that one to Jamie, simply because I know you're looking at healthcare solutions. We'll talk about those in a moment. I know you were in touch with the Director General of the World Health Organization within the last week or so. What is your sense of how they feel? Do they feel impotent? Do they feel unfairly blamed? Do they feel that they've got a handle on things? What do you think?
Well, I think they really have the WHO has a big challenge and a lot of work coordinating all the countries in the world to take a coordinated response for COVID-19. And where I sit in terms of looking at R&D, research and development of drugs, vaccines, and diagnostics, we see WHO as playing an absolutely critical normative role. They help to provide the technology assessments to give that gold stamp of approval to say that a certain product or a certain intervention is viable for response. And actually, we've been very closely monitoring their work on leading the Solidarity clinical trials, where they're looking at existing therapeutics and which ones might be viable to treat COVID patients.
Okay, so you think they're doing a pretty good job in pretty difficult circumstances. What about Bill Gates' suggestion that it's going to be the poorer countries that are going to suffer the most? It's well-developed countries at the moment. None of them should get an A grade for this. When the disease hits those least able to cope with it, we are going to see a second wave that is possibly more damaging than the first. What do you make of that?
I completely agree with his concern as we look at low and middle income countries' abilities to respond. I mean, we see in high income countries how devastating this disease has been to our countries, to our health systems, to our economies. We're bracing for that impact to be even worse in low and middle income countries where they don't have the health infrastructure, they don't have the diagnostic tools, they don't have the ventilators and all the health workers with the ventilator intubation training. And so this is a really big concern, and it's particularly why the coordination role of WHO is important. It's also the reason we're actively supporting the work of Gavi and the Global Fund, so that when an intervention comes online, when there's a viable product or vaccine out there, that partners like that, multilateral partners, are able to help ensure that those technologies can reach all the supply chains and the health systems where they're most needed.
Okay, back to you in just a minute, and we'll talk about what work is being done, Jamie, on vaccines. But Anthony, European Council on Foreign Relations, let me ask you about the different responses across the continent of Europe. How much of this is politics at the moment, what we're seeing in Europe?
Well, I think there was an understandable reaction at the beginning that each country was going to look after its own citizens. And, the crisis hit sort of successively, first of all, the southern states, Italy, and then Spain and France, and Germany has been a little less affected. And at the beginning, I think, countries were looking inward. And certainly in Italy, there was a strong sense that they weren't receiving the kind of solidarity and support from EU colleagues that they were looking for. I think that's changing now. We see much more attention at moving supplies around within the EU, at having a joint procurement program to try and build up supplies, countries treating patients from other countries. All of that is kind of being focused on now because I think there was a sense that this is kind of a crucial test for the EU. And if it looks like every country is on its own, what does that mean for European solidarity? But the big test is still to come, I think, and that's on the economic and financial side, because of course,
okay, and as you say, the real test is yet to come. But let me ask you this: do you get a sense that institutions globally are going to come out of this having learned lessons and therefore perhaps stronger when it comes to working together in the future, or whether in fact the foundations will have crumbled?
It's a good question, and it's hard to know. This has a paradoxical effect, this crisis, because on the one hand, I think people are looking to their governments to help them. But on the other hand, this is a crisis that can only really be dealt with through international coordination. That's true in developing vaccines. That's true in helping, as Jamie was saying, the worst off countries. And if the virus is spreading in the developing world, it'll come back to the developed world. So as the Secretary General of the UN said, we're only as strong as the weakest link. But so far, we're still only, beginning to look at the international ramifications. I hope that there will be that kind of multilateral cooperation, but it needs to be stepped up. And as we were saying, this is a time when global leadership is not as strong as it could be.
Jamie, there's a group called the Coalition for Epidemic Preparedness, CEPI, and you look at its website, it says it's working on, in some way or another, 115 different vaccines for this disease. Can you give us an idea, because I know you work closely with them, how this sort of coordination on a global level works?
Absolutely. So I think it's important to note it's not that they're the ones researching the 115 vaccines, but they're tracking and understanding the pipeline of global partners in countries all over the world of researchers who are working on different vaccine candidates. And I think of the 115, depending on if you talk to them or WHO, there's about 3 to 5 candidates that are now going into clinical trials that have quite a lot of promise. I think you've heard many different physicians and researchers say this, but the idea that we can have a vaccine in 12 to 18 months is extraordinarily accelerated. It's unprecedented. I mean, we think about decades of research on HIV and TB and malaria looking for a vaccine, and those efforts are ongoing. But the good news of having a mechanism and a platform like CEPI is they can bring together all of the ideas, all of the research of scientists all over the world, and look for those most promising vaccine candidates that then could be potentially deployed. I think the other good news of having a group like CEPI working on this is they're starting to think about global access. They're thinking about the global manufacturing, the end-to-end product development, and making sure that those vaccines reach not just the US or the UK or Europe, but make sure that they're able to reach the populations that also need them in low and middle income countries. And
okay, well, let me throw that onto Anthony. They may be thinking about it. These are the research scientists, but what about those people who eventually will have to pay for it? The governments, are they thinking about it getting to the most needy, to the poorest people?
I think they're thinking about it. The question is, when are they going to act? And I think most likely this will be done at the level of the G20, right, which brings together the 20 richest and most powerful countries in the world. That would seem like the obvious location to try and mobilize these kinds of resources and then feed them on through other institutions to get to the most, the countries most in need. We're seeing, I think, the first thing we'll see is an initiative on debt forgiveness or debt deferral, at least. And there are signs that that'll come perhaps in the next few days. And then beyond that, I think there will be some effort. The question is, at a time when countries themselves obviously are worried about their own economies, will the effort be on the scale that's required? And that'll be what we have to look for in the next coming weeks.
You mentioning debt forgiveness just then reminded me of Gordon Brown, former Prime Minister of the United Kingdom, who sort of led the global campaign to write off international debt to those countries that could least afford it. Is there anybody who's standing up, putting their head above the parapet to say, listen, I am the sort of person to take on this global challenge?
I think, it's hard to point to one single figure. Within Europe, we've seen strong national leadership from President Macron in France and Chancellor Merkel in Germany. But I think if anything's going to happen at the global level, it's going to be a coalition. It's going to be a group of states coming together putting aside the kind of divisions and tensions that we've seen in the last few years, say, between China and the United States, and trying to mobilize a response that leaves politics aside. And that, that could well happen, but I think it's hard to see one figure galvanizing it. I think it'll be more a collective effort, and I certainly hope that we get it.
Jamie, in times of conflict, or in times of warfare, normally, you see massive scientific and engineering leaps forward. Are we likely to see the same sort of thing here, given the fact that this is a global crisis? In terms of, you talked about a 12 to 15 month timeline for getting a vaccine ready. Will that become the new norm, et cetera, et cetera?
It's hard to say whether that will become the new norm, but I think that this experience, the fact that we're dealing with a truly, truly global pandemic, is testing our global health infrastructure and our research infrastructure, and may forever change the way that we conduct research and development, that we break down silos between different disease health research areas, that we think about at a new level clinical trials being rolled out to multiple countries at once, and perhaps a greater ability to coordinate. I mean, I think as we think about even regulatory coordination of these products as they come online, we may see some models and some case studies and examples that can be leveraged in other health and disease areas in the future. And if there's a silver lining that comes out of this, that's what I'd love to see, is a strengthened architecture.
Do you think we need to see a reform of the World Health Organization, because it has been described variously as toothless, weak, et cetera, ineffective, giving the wrong message? Does it need to have something more legalistic at its disposal, given the fact that this is a virus, a conflict, if you like, that is actually challenging the entire globe?
Yeah, it's a good question. I mean, I think the WHO was particularly structured to be responsive to the interests of its individual member states and to be playing a normative role. I think they are playing that role. It seems that some stakeholders are asking them to do more or to take a more pointed or more directive action. And I think that's often been debated within the global health community of what WHO's work and responsibility and mission should be. I do think that's on the table for being discussed. And what do we actually want to see WHO to do that they're not doing now?
Anthony, what do you think? Does it need to have more teeth?
It's difficult at the moment. I think we're in a climate where there's a lot of reluctance to create new kind of legally binding international mechanisms with greater power over nation states. And we see in a range of issues, a move more towards kind of voluntary codes of conduct. And I think really what we need more than anything else is a kind of change in the political culture at the WHO for them to, I don't think they're going to have legal teeth, but I think they should just be more assertive in terms of sounding the alarm, challenging countries, really demanding access, demanding answers. That seems to me, a more likely avenue for improvement rather than something that's going to change their legal foundation.
Okay, we talked there, both of you did talk about what good could come out of this, perhaps. But in terms of where the biggest failures have been, Anthony, you first, and then you, Jamie. Are there some very obvious failures that could be remedied in terms of global leadership and the international response?
Well, I think there were failures in terms of preparedness, but we have to understand that this is a pandemic which spread astonishingly quickly. If we look back, it was only a matter of 3 or so months ago that the disease was just getting started, and now we're in a situation where all over the world, countries are in lockdown. So it did move quickly, and I think countries just weren't ready. And there wasn't enough information. The information that was spread around then wasn't acted on fast enough. Countries were unprepared in terms of their medical supplies and the protective equipment that we've heard so much about. So, I think more kind of coordination and moving faster would clearly have helped. But it's a big ask because of the novelty of what we've seen.
Okay, let me just throw that one at Jamie. Yes, the novelty of it all. Was there any way the world could have been prepared?
On one hand, we've known, and WHO and other stakeholders have talked about disease X and the next unknown threat of pandemic potential. And some scientists and researchers will say they've seen this coming for years, and others will say this materialized so quickly. I mean, I think the thing that we do know is and the failure we need to work against is silos, not just in health and disease areas, but we need countries to truly step up and be collaborative, whether they're collaborating and investing in supporting mechanisms like CEPI. We've also, beyond countries, seen the Gates Foundation, Wellcome Trust, MasterCard, and other partners come forward on the therapeutics accelerator and supporting what drugs might be viable for COVID-19 and mitigating COVID-19. We need countries to step up and not just act on their own, but bring together a grand challenge or an innovation exchange to bring together the ideas of what diagnostics and PPEs and ventilators and other medical technologies are needed globally. This is not a one country solution. That's not how we win. We need to ensure that there are viable interventions for everyone, and that those interventions are accessible and affordable to everyone everywhere.
Listen, thank you very much for taking part in this program, and thank you for watching this edition of Roundtable. From me, David Foster, behind the table on this occasion. Goodbye for now.